Hi everyone and welcome to another video from the CTAD clinic. My name's Dr Mike Lloyd, I'm director of the clinic and I'm going to talk to you today about what I think is the single most important therapeutic response for people working with folks who dissociate. So this is ideally targeted at therapists, but it's a really important thing for anyone to know. Thinking about therapeutic skills. Before we get into that, it's important to know that there are foundations to working with anybody. So this isn't necessarily directed at working with people with DID, this is pretty much what we need to think about when we're working therapeutically. So this is like clinical skill set that we have to have. The most important thing is that people have the appropriate qualifications and experience. So regardless of anything else, you have to be appropriately qualified and suitably experienced to take on the work. So basically work within the competency. That's keystone. The next one is that we have supervision, so people that are working with anybody in mental health services are appropriately supervised, and that's a really important resource that sometimes gets overlooked in the sort of the chaos of a large caseload, for example. We have to make sure that we're working with safe working practices, that we're appropriately connected to training and things like safeguarding practices, protocols and policies that we might be working under. All of those have to be in place. And then lastly, there's got to be a good room. This is really a bone of contention in many places. Some people just don't have a good place to see people in, or they may have a different room every time, and I think it's certainly not ideal, certainly when you're working with someone with dissociative amnesia or derealisation, for example. Working in therapy in a room that's changing from one week to the next. Might be nothing that the therapist can do about that. It depends on the sort of the place that they're working in. But the ideal is that you have the same room every time. So consistency. So all of those things need to be in place before we consider what is the best therapeutic response that we can actually deliver. Here it is, and it's probably not going to be a massive surprise, but it might be something that validates a lot of work. It's the gut instinct. It's the thing that the therapist feels inside when they're doing work with people, especially in dissociation. There is something different about this work. It's not a manualized type of procedure that we put together. There are guidelines for how to work, but we have to listen to our gut instinct. I'll give you an example of that. Let's say as a therapist is doing some drawing work with a client and it's going okay, pencils and paper, the various bits and pieces might be there, you might be sort of kneeling next to each other, you might be sitting opposite a coffee table, you might be sharing a space again on a normal table. And in the process of drawing this picture, you might be, say, mapping an internal system, something changes. You can just feel that the person that you're sitting next to or sitting opposite has changed somehow. They've become distant, they've become quiet. There is something about what they're experiencing that gets channeled into you. There's lots of different processes for what we might call this that we're thinking about, stuff like projection, transference, countertransference, all of those things can be taken in on an intellectual level, but we've got to understand that our gut instinct is something that we trust in ourselves. And if there is that thing you're starting to draw and something has changed, and this kind of internal feeling from the therapist says to you, put this stuff away. Close the book, close the colouring book, close the painting, put it away and say, perhaps we need to move on to something else. And you'll probably get a sense of relief coming from that client that you're working with. Something has shifted in the room and it's really important that you take care of that. It could be that you're about to ask a question or about to walk into or wander towards a conversation topic and you're doubting whether this is a good idea. There's something about that interaction, something about the relationship that makes you doubt whether to proceed, and you feel like maybe the right thing is to do is shelve that another day. Listen to that voice. If you're having regular therapy sessions with a person, it's really important that you don't push too far, but also that you don't pull so far back that you don't actually progress for anything. So we have to take these steps forward in therapy. We just have to be extremely cautious how we do it, and our gut instinct often tells us whether what we're about to do seems like a good idea or a bad idea. And for me as a therapist working with people with DID for over 10 years now, I have listened to that voice many times, and occasionally when I have ignored it, it's not gone great, and that moment in therapy really doesn't work out too well. So do listen to that gut instinct. If you'd like to know a little bit more about that, you can look at Stephen Porges' polyvagal theory that talks about the sort of the vagal nerve that goes between the brain and the gut. So there's literally a nerve that connects our gut, our visceral organs, to our brains, and that is a highway of great communication that if we ignore it, we do so at our peril. So it's really important that we take account of that. The gut instinct can be used as a therapeutic tool. You can say to the client, I felt that something has shifted and I think that we need to stop for a second, pause, think about what's going on, and maybe consider whether we should move forward with this conversation. Or you just say to the client, you know what, perhaps we're done with this conversation, perhaps we need to move on. So there you have it. It's your therapy voice. As the therapist, you have an internal voice. It's not a dissociated voice, it's your instinct. And it's really important that we channel into that and listen. So I hope that's been useful to you. If you like the video, if it is useful, feel free to share it to your therapist or just reflect on it for yourself. Please click like and do subscribe if you'd like additional content coming out of the CTAD channel. And yeah, I look forward to putting some more videos out and talking with you again soon. Take care out there, and thank you very much. Bye now.